My name's Nicola. I'm a clinical specialist physiotherapist here at Cambridge University Hospitals. I work as the service lead for our cancer rehabilitation programme, which is called Rehabilitation and Exercise During Addenbrookes Cancer Treatment, or REACT for short. At REACT, we provide individual physiotherapy input for patients experiencing musculoskeletal or neurological effects of their cancer treatment, alongside providing safe opportunities for patients to exercise whilst undergoing their cancer treatment. We offer one-to-one exercise instruction and group exercise, including prehabilitation, circuits, Pilates, yoga, Tai Chi and more, as well as running education sessions for particular tumour types and conditions. Some patients will be referred to the service automatically, especially if they're undergoing a particular surgery or treatment. Other patients will be referred by their consultants, clinical nurse specialists or other allied health professionals, such as radiographers, occupational therapists or dietitians. You're also welcome to self-refer to our service. The instructions and the contact details can be found on the CUH website. In the past, patients were regularly encouraged by their clinical teams to reduce physical activity and exercise participation following a cancer diagnosis. Patients would then avoid physical exertion, put exercise on hold, and be far less active. Friends and family could sometimes exacerbate the problem by stepping in and carrying out activities around the house and garden. And this intention, although well-meaning, often contributed to the overall reduction in activity for that individual, which has since been found to have a negative effect. Observations in the early 2000s showed that physical activity and exercise were safe during cancer treatment and could actually reduce the chances of cancer survivors going on to develop diabetes, coronary heart disease, osteoporosis, and even becoming overweight. Since then, many studies have been looking at the effects of being physically active and participating in regular exercise whilst receiving cancer treatment and in those early months after finishing their treatment. The studies have shown a huge number of physical benefits for cancer patients, such as maintaining a healthy weight, improving physical functioning and maintaining strength, movement and flexibility. Improvements have been seen in bone health and bone density, and there's also been shown a reduction and development in the severity of cancer-related fatigue. A number of psychological benefits have also been noted, which include reduced levels of anxiety and depression, reduced levels of stress, mood improvement, better sleep, and an increased quality of life. Last, but certainly not least, is the potential that physical activity and exercise can have on disease progression and prognosis. Studies indicate that regular exercise participation can potentially improve survival rates in some tumour sites, including breast, colorectal and prostate cancers, and it has the potential to improve the outcomes of many more types of cancers. The beneficial impact of exercise during cancer treatment is thought to be due to a number of different effects on the body. These include prevention of high levels of insulin, lowering levels of some types of hormones which drive tumour growth, reducing inflammation, and improving our immune system, as well as helping individuals to maintain a healthy body weight. Our aim in REACT is to help you maintain and increase your physical and mental well-being throughout your treatment so that you can stay healthy, tolerate treatment and hopefully reduce the incidence and severity of many of the common side effects of treatment. We work closely with other organisations such as Macmillan and our local Maggie Centre to offer a range of opportunities for patients to improve their physical and mental well-being during cancer treatment. We want you to develop a healthy relationship with physical activity and exercise during a time of uncertainty. The aim is to give you some control over an important part of your treatment journey and the confidence to exercise safely. Using the best available evidence around physical activity and exercise in cancer survivors, expert clinicians and researchers have put together guidelines and recommendations for the amount of exercise that individuals should try to meet. The key recommendation, however, is that adults should try and undertake at least 150 minutes of moderate intensity exercise per week, or 75 minutes of vigorous intensity exercise per week, or a combination of both. Whilst we do have patients undergoing cancer treatment who are incredibly fit and well, the majority of our patients would not feel comfortable exercising independently at a vigorous level. We will therefore focus on exercise at a moderate intensity level in this film. In REACT, we try to consider the individual from their previous exercise experience, current level of health, and the treatment that they will be undergoing. There are 3 key areas discussed with patients: reducing sedentary behaviour, increasing physical activity, and then participating in regular exercise. Reducing the amount of time spent sitting at a desk, driving a car, watching television or being on our phones and tablets is a great starting point for the majority of patients, as this inactivity can be detrimental for our health. It's really important to become less sedentary and more physically active in your day, and those habits should become part of your daily routine. The real benefits from physical activity during cancer treatment can be seen and felt once you begin to incorporate moderate intensity exercise into your weekly routine. Intensity is the individual perception of how much effort you have to put in to perform a certain activity. Light intensity exercise does not typically increase your heart rate or breathing, as it does not cause any change in how hard your heart and your lungs are working. Moderate intensity physical activity should make you feel that you are working somewhat hard. Your heart rate might increase and you may start to feel warmer or begin to sweat. You should feel slightly short of breath, but you should still be able to talk in full sentences. The preferred method of gauging exercise intensity is by using the Borg scale, where the aim is to perform an activity or an exercise to an intensity whether you feel you're working somewhat hard. It's important, however, to remember that it does not matter the actual activity or exercise that caused you to feel that way. What matters is that how you are feeling at that point in time. For some of our cancer patients who are normally very fit and well, their moderate intensity activities may include aerobic exercise, such as walking, running, cycling, circuit or boot camp sessions and classes like Zumba. For the majority of patients, however, it might instead be activities around the house, such as household chores, DIY, gardening, which could also have the same effect. And therefore, the time taken to perform those exercises can all be taken into account when looking at that 150 minutes over the course of a week. The most frequently undertaken moderate intensity exercise is, of course, walking. It's free, it's accessible to most, and it doesn't require any equipment or a gym membership, and it can be a social activity that you can do with family and friends. The recommendations are 150 minutes of moderate intensity exercise per week. However, you can often see this recommendation worded as 30 minutes of moderate intensity exercise on 5 days of the week, which adds up to the same total of minutes per week. As therapists, we often prefer this 30 minutes a day recommendation because for many patients it does not seem so daunting and can be a much more realistic goal, and many prefer the little and often approach. For some patients, however, even 30 minutes of moderate intensity exercise in the form of a walk can seem off-putting, either due to experiencing some of the associated side effects of cancer treatment or because they're struggling to fit exercise into their daily and weekly routine. The good news is that bite-sized chunks of exercise have been found to be just as effective as longer bouts of exercise and can improve cardiorespiratory fitness, reduce blood pressure and blood sugar levels, and be effective at helping people to lose weight, body fat, and lower cholesterol. Any length of exercise will count, but practically 3 10-minute bouts work well for most. If 10 minutes is too much, then 6 5-minute bouts will work just as well, and some patients will start with just 2 to 3 minutes of exercise at a time, especially when they're recovering from surgery. Work out what works best for you. The last exercise recommendations relate to strengthening and balance exercises. We recommend that you should try to build strength on at least 2 days of the week to keep muscles, bones and joints strong, as well as performing activities which can improve your balance on at least 2 days of the week. We hope this film has encouraged you to remain physically active during your cancer treatment and given you the confidence to include exercise into your daily routines. Please remember, the best form of exercise is the one that you will keep doing every day, so try to find the exercise or activity that you enjoy. Don't forget, some movement is good, but more is better. Thank you for watching. If you would like to find out more information about REACT or other forms of exercise, please visit the REACT page on the CUH website or drop into the Cancer Support Service.